Sometimes it's hard, isn't it? To be diagnosed with diabetes and have to live with it. In my video, I have highlighted the key things you need to incorporate in your activities of daily living so that it weighs more easier on you. If you know someone that is diabetic, kindly accord them moral support. They need all the support that they can actually get. If you are a newly diagnosed patient with diabetes mellitus, the most important thing I would love to talk about is accepting your diagnosis. I have seen many patients go to the extent of doubting doctors, and I want to emphasize that for a doctor to come up with a diagnosis that you have diabetes mellitus, it takes more than one test. I have seen others go outside the hospital without actually accepting their diagnosis, and they go to spiritual people to even talk about these kind of things, and these spiritual people end up telling them not to use medication, that it is a lie. If you get diagnosed with diabetes, before stepping out of the hospital, please involve your doctor. Tell your doctor that you do not believe that you're suffering from diabetes. Ask for the evidence, and if you need to be enrolled in a support group, kindly do so. I have realized that diet is the most stressing factor of a diabetic patient, whether they have been newly diagnosed or whether they have been living with this condition for many years. I personally do not believe that there is one diabetic diet. Prove me wrong. But I will say one thing: when we are telling you to make adjustments in your lifestyle, we tell you in your diet to reduce the amount of starch that you're taking. If you're reducing the amount of starch that you're taking, it means that how you get energy is impaired. So we are going to tell you what I'm actually telling you at this moment is to incorporate more protein in your diet. Do not go for very poor sources of diet that are actually unhealthy. The sources like bacon and highly processed types of diet. Do more poultry, like do turkey, do chicken if you're missing meat. Otherwise, just go for beans and lentils. These kind of proteins, they are more healthier for you. What we tell you in your diet is to go for the healthier options. Avoid highly processed foods like white rice. Go for whole grain type of this food. The brown rice is actually more healthier for you. The brown flour is more healthier for you. We are not telling you to completely cut the whole thing off. And I understand as a newly diagnosed patient, it's going to take you a lot of time. It's going to be so stressful to have to leave what you've been doing before and incorporate these new ways of healthy living. But with time, you're going to get it. The next thing about your diet is to try as many vegetables and fruits as you can. Of course, do not consume fruits in bulk. They are rich in sugar, but do not worry about that. Like the sugar in your fruits is not processed. It is not added sugar. It is a natural sugar, and that is actually good for you. It could even help you to avoid episodes of hypoglycemia. And this is when your sugar levels go really low in your system. You can incorporate these fruits as a snack throughout the day, together with whole nuts, like groundnuts and peanuts, instead of the usual kind of snacks that you're used to, the kinds of chocolates and ice cream. Cut down the amount of fat and butter that you are doing if you are diabetic. And try to substitute this with more healthier options, even if it is animal fat. Just try and do fish if you're craving that fat thing from the cow or something. Fish is a more healthier option. Substitute this with vegetable oils. And I'll tell you one thing about vegetable oils: the more expensive it is, the more legit it is. For example, virgin olive oil is actually perfect for you. Corn oil, sunflower oil. These are the healthier, good options for you. Generally, if you master the art of a healthier diet and choose the right options like healthier vegetables, healthier proteins, and do less starch, then you have it all covered with diabetes. Do not overthink your diet. If you're having problems with calculating the amount of calories you're supposed to consume, kindly consult with your nutritionist. I will need to talk about drug adherence. This does not even apply to diabetic patients alone, but in this case, I'm addressing this issue particularly to you. If you know someone that is suffering from diabetes, if you're the person that is suffering from diabetes, please adhere to your medication. If you're having problems with adherence because of whatever reasons, probably you feel that the dosages are so high and they're kind of crushing you, like you're getting episodes of hyperglycemia or hypoglycemia, kindly visit your doctor so that they make adjustments. I have seen many people go days without taking their medication, and their reasons were, my sugars were so low, that's why I did not take the medication. If you're a person that is actually using insulin for medication, I want you to understand that you can develop resistance from insulin. Now tell me as a patient, you tell me, if you develop resistance from insulin, what drug do you think we are going to use on you next? Do not take medication that is supposed to be taken twice a day and do it like in one sitting. It is not going to help you. If you're skipping medication because your sugars are quite low, that is understandable. But what we usually advise in such kind of cases, kindly eat food and then do your medication. Do not admire to get resistance from anti-diabetic medication. So the most important aspect in this point is to not regulate your dosages at home. If you are experiencing any side effects because of the medication that you're prescribed to by the doctor, kindly go back to the doctor so that they make these adjustments by themselves. It is important for you to have your blood sugars monitored regularly. If you cannot afford a glucometer at home, kindly visit your nearest health facility so that they be doing this on a regular basis, especially if you're newly diagnosed and you have zero idea of how to understand when your sugars are going low and when to understand, like signs that come up when your sugars are going low or signs that come up when your sugars are going high. The most important thing that happens, by the way, is if your sugars are going low, the signs that might come is you're going to be really sweaty and you're going to feel a lot of dizziness. When your sugars are quite high, you're going to be frequently going to the toilet to urinate. Blurred vision and excessive thirst. On the other side, besides getting sweaty, you're also going to experience a lot of hunger, and you could also even experience episodes of fainting in between. If you're a diabetic patient, kindly remember to have your blood pressure monitored regularly. And this is because hypertension sometimes occurs as a result of you suffering from diabetes. There is a relationship between the two, in which I'll explain maybe later, but it is very important that you get your BPs monitored. In this case, if you're developing hypertension, the doctors are able to start you on antihypertensives really sooner than later, and this helps in reducing or actually cutting out complications that might arise from you not getting your hypertension, like your blood pressure, in check. And these complications are such as stroke and heart diseases. Do not stay home for months and months without booking a clinic with your physician or your doctor. It is important for them to keep a closer eye on you if you're suffering from diabetes. This is because they are target organs for complications of diabetes, and these are organs like liver and the kidney. They will need to do routine blood tests like the liver function test and the UECs to actually assess whether these organs are functioning properly or whether they are getting affected because of your condition. The sooner they realize that there is a problem arising from your organs, the earlier they're able to actually start you on treatment. The other reason as to why you should consider having your appointment with your doctor, especially at least monthly, is because diabetes also causes problems with your eyes, you know. If they realize there are problems occurring with your eyes, for instance, the having any retinopathies, you could be developing cataract, they're likely to send you to the ophthalmologist, and this would actually make your living quite easier. The last point I'm going to be talking about is foot care. As a diabetic patient, it is particularly important for you to take care of your feet. This is because if you get an injury in your feet, it can take forever to heal, and these kind of things can lead to diabetic foot, and diabetic foot can actually lead to amputation in the later times of your life. So there are some things that you can do to avoid this. If you're going to wash your feet, wash them properly with soap and dry them, especially in between your toes. Then remember to apply grease. If you are going out there, please remember to put on some closed shoes. If you can put on your shoes with a pair of socks, kindly remember to do that. This minimizes chances of you getting any types of cuts or injuries when you're going out in your farm or when you're going out with your friends. Otherwise, guys, I really appreciate you if you've watched up to this point. It has been a pleasure having you all along. If you've learned something or you've liked anything that I've said in my video, kindly give me a thumbs up, and please remember to subscribe. And I hope that I will see you in my next video. Goodbye.